for people to join in.
Sure.
C0. Hello.
Is it from if people access from another platform, we will also see it as well?
Yes. So now, can you see 3?
3, yeah.
So can you see someone writing on the chat box? Yeah. Okay, cool. So hello, everyone. Hi. Yeah, you are number 1.
Hello.
Hi. So we'll wait a few seconds.
Sure.
I'm going to share our QR code. Hi. Hello, everyone. So for those who haven't followed and liked our Facebook page, please scan the QR code and yes, like and follow our page. Hi. Thanks for coming. So we have 10. Our target is 10. So more than 10, we are happy.
Yes.
Hello. Okay. Okay. So, hi. Welcome, everyone. Nice to see you back today. So, again, my name is B. I'm the founder and director of Dana Charity Group. And today we have Dr. Peng with us. Dr. Peng, his full name is Dr. Ho Chi Peng. So, Dr. Peng is a medical doctor currently working as a frontliner in Hospital Kepala Batas. He has been working with strong teams in Penang, managing COVID patients since this pandemic hits Malaysia. And the reason why we're having this Q&A session with Dr. Peng is because we understand that many of you from Malaysia probably have some confusions, doubts, and questions regarding the current clinical management or setting for COVID patients. And today's session would be multilingual sessions. So questions are welcome. So you can write to us in Chinese, English, or even Malay. We'll try to answer it. And yeah, so Dr. Peng, do you want to introduce yourself?
Hello. Hi. Thanks, B, and everyone. It's great to see a good crowd in this lovely afternoon. It is quite hot and sunny in Penang here. So Peng is my name. I'm currently working in Kepala Batas Hospital for a number of years now. And then I was privileged to actually have the opportunity to work with various people in managing COVID patients. So thanks for joining the webinar this afternoon. I would like to make a small disclaimer that whatever we discuss here or what I say are mainly based on my personal experience and also knowledge about what happened in our situations up to date. And it could change the next moment, and then practice or certain information and how things being dealt with may differ from one place to another. So please feel free to throw in any questions so that I will try my best to answer it if I get an answer. So thanks.
Yeah. Thank you, Dr. Peng. So first of all, do you mind to tell us more about your experience in this pandemic? For example, any dynamic changes on the management of COVID patients?
So actually, I think Malaysia start to experience the first hand on this before it was declared pandemic was early cases from Wuhan back then in January 2020. So Penang was involved earlier due to the I mean, like people travel, and then we have cases in Singapore, and we start to get alert. Where I work in Kepala Batas, back in March last year, we actually got ourselves prepared, and we opened up a ward, which ended up that we closed it within a month because we were expecting some patient, but at that time, I think the entire Malaysia, there was actually very low cases. It was well managed. Then we closed down the ward. It was not until October last year, when there was a surge after the third wave, that we need to open up just one ward. And progressively over the last few months after October, by February, we already opened up all our wards, and our hospital has turned into a fully COVID hospital, including our ICU, our normal ward, and then we cater patients from all backgrounds as well as age group, and regardless of nationality. So far, by today, we have managed more than 3,000 patients since October last year. So we have managed those from babies, few days old, up to the elderlies in the 90s. So a majority of them went home well, and hopefully they remain well, because there was a lot of unknown and uncertainty about what happened after you got COVID and recovered from the hospital. And we also have set up our service by stages, because earlier on, when our hospital started its service as a COVID hospital, it was kind of a hybrid hospital whereby we still had some non-COVID patients before we gradually turned into a fully COVID hospital. So by catering for the needs as a fully COVID hospital, we have now developed a protocol and also services to cater for a COVID mother who require delivery, and very ill patient require ICU care. So some of you may be familiarized that with the news earlier on, I think about a month ago, that our hospital was also working closely with the Malaysian Armed Force to establish the first ever field ICU in this country, which means that it was used to be a mobile hospital, that they have the facility, and now at this time we find a location within the hospital compound to locate them and convert this facility into a field ICU that we have up to 24 beds, with a lot of support from the ministry, NGO, and so on. So it was a great experience for us. And in terms, I think, because COVID from epidemic in China, which gradually grown into a pandemic globally, it was actually in a sweep of a few months. And now we are already 18 months into this pandemic now, yet there's still a lot of uncertainty. So I think many of us constantly being confused, and sometimes we do not know which information is correct or not. And it's because that there are so many studies going on, there are so many information revolving, and then we are trying to catch up what is the best we can in order to give to provide a better management and also information dissemination to the public. So I think as for all of us, whenever there are doubts, we should try to clear off rather than keep it to yourself. So
Yeah, thank you, Dr. Peng. And you mentioned you have already treated, Hospital Kepala Batas has been treated 3,000, more than 3,000 patients, and even including baby. And now is Hospital Kepala Batas is like fully COVID hospital or still hybrid?
we is considered a fully COVID hospital. We only hospitalize patient diagnosed with COVID or probable case suspected of COVID, so that because I think in Malaysia we have our health service and also system are ever evolving and they are transforming. So we have a concept in Penang is called Cluster Hospital, so that other states as well. We have about 4 hospitals located over the mainland of Penang, catering for the needs of about 1 million population. So these 4 hospitals was catered in different areas, and then only our hospital here that we actually take in COVID patient. Therefore, we reach a consensus that to become a fully COVID hospital, if there's any other COVID cases diagnosed in other hospital, we will take them in. And then the other hospital will take the non-COVID patient, because our emergency are still open. We don't close our emergency and refuse any visit for patient, because we still actually have a lot of patients who suffer from non-COVID diseases. I think the pandemic has gave us so much to learn, and also challenges is this what we now learn, that it is collateral damages, because we are seeing a lot of patients coming in, they could have heart problem, they could have some emergency which is not COVID related, and then we have to actually send them up to other hospital, our sister hospital, for this to ensure that they are well taken care of. So it's part of the cluster hospital concept for this to make it happen.
So do you think, is it more appropriate that we let the public know, like, for example, this hospital is mainly for COVID, and if you have other non-COVID disease, probably you should go to, other, like you said, sister hospital to save their time, all these things?
We have actually done that in the past, because we have the hospital visitor boards. We also put it up in the public social media via the state government and also state health department. And it is easier to say than do, because when during the emergency, most of the public, they would have to go to the nearest hospital to get the immediate help first before we try to plan subsequent care. And then, as example, some of them, they have heart attack, and then or stroke. It is actually, the time is brain, time is heart. So they have to go to the place to come to our hospital to get the diagnosis established and quickly get some immediate treatment before we send them out to another hospital for further care. So it's a little bit hard, especially for our maternity care. That means that a woman who need to deliver their babies, because when a woman come in with a sign of labor, that means that the labor is imminent. They need to get the attention stat, and we could not actually. Sometimes if we want to send them from here straight away to another hospital, the time may be a little bit long. So we would want to try what we can do here. Even though saying so, because now as we learn better, we actually all the patients who come into a hospital setting, we have a very low threshold. That means that we actually try to screen everyone, if possible, who need to be hospitalized for COVID. So at least that we have picked up quite a number of them. Actually, they have COVID. They have infected with COVID, but they did not know it. They do not know when they were exposed to it. They don't really have the exact symptoms, but they have something else. For example, a person coming with a heart attack, but they actually also have COVID infection. Therefore, we will try to, we have a strong clinical team here, so that we will admit to our site, and then we will treat the heart attack in our hospital while providing a good isolation for the patient, so from infecting other people, so in the community and other hospital.
Yeah, it sounds tricky and difficult for medical team and patients. So I will change my language now. So 如果大家有一些关于 COVID 疫情的问题，你们想就是用中文来发问，可以打在我们的那个留言板。If you have any questions to ask, you are welcome to type in our chat box. So thank you for letting us know. So what happened? What do the patients or their family do if they have been infected?
First of all, I think at the earlier of the pandemic, when it was a low infection incidence, that means that the number is not that high, we will manage it a bit differently. But at the moment, the first thing we will tell is, please stay calm. And after they stay calm already, once they get infected, generally, because for a person to know themselves get infected, they have to go for a test. A test could be either at a health facility, either at a clinic, a hospital, or even in private lab. And whenever a patient was tested positive, they will be informed, and then the case will also be brought by the person who performed or run the test to the nearest health clinic, where or the what we call it is the administrative part, the epidemiological unit for the district health unit, for them to actually take further action. Then they will start calling the patient, calm them down, making reassurance that they will do the assessment. Because at the moment, before early this year, there's no home quarantine practice. All patients who were infected, whether suspected or confirmed, they were all being brought into isolation facility, be it in the hospital or a low-risk quarantine center like we see established throughout the country. So at the moment, because as a case growing, actually the isolation facility is running out of bed. So the concept of home quarantine comes in, and they have a very strict list of criteria that to enable the person qualify for home quarantine. Therefore, the doctors or the investigator, the health inspector will contact the person who got infected. They will go through a thorough assessment by asking a lot of questions, and then make sure that they are being categorized and stratified properly before assigning them whether they are okay to be actually undergo the home quarantine. And then if they are not suitable for home quarantine for whatever reason, then they will either be sent to the low-risk quarantine center or hospital for the quarantine purpose or treatment purpose. For the time being, that those who are under home quarantine, it's not just left like that. After you have been home quarantined, you will be followed up daily until your period of quarantine. And during the home quarantine, you will get a phone call every day to assess your symptoms and also what happened. Shall you have any concerns or issue that arise, suddenly you are feeling unwell and so on, then we will arrange for the hospitalization. We will arrange an ambulance to go and pick up the patient from home and then admit to the nearest hospital and so on.
Yeah, and I saw like someone suggested about pulse oximetry at home. So is Malaysia practicing that? Encourage people to purchase pulse oximetry. But before you answer, just let me to repeat what you say. So 刚才那个何医生是在解释，就是现在马来西亚有推行在家隔离的计划，所以可是在家隔离呢是需要经过一系列的筛选，然后如果那些在家隔离的病人呢，就是医疗人员就会打电话来跟你 follow up， 就每天会问你情形，所以不会就是让你自己在家自生自灭的感觉，所以还是会有人就是关心你的病情。如果你是其中一个在家隔离的患者，那现在在问何医生关于就是pulse oximetry， 就是一个一个小的机器可以放在你的手指，然后可以测你的血氧浓度。所以我们听听何医生怎么解释这个问题。Yeah.
Thanks for the question. In fact, this is something that we should all think about. Like, years back, we don't have glucometer or blood pressure machine at home. It is always think that it is something to be done at the health facility during assessment. But these days, you can see almost every household, especially those educated ones, that they will actually equip themselves with this BP machine or glucometer. Now, once we go with a pulse oximeter, is a very interesting concept. In fact, it is important because as we learn more about COVID over the last 1.5 years, we actually observe that people with COVID, they don't go through a process with acute deterioration. What we call it is a very progressive. It would take some time. So that one of the things that in COVID, when you get a COVID pneumonia, the lung infection, that means you get a COVID infection, not necessarily that you will get a lung infection, but some proportion of the patient will get into the lung infection and they will develop this happy hypoxia. I think many of us will come off this term, which means that your body is trying to accommodate that when you have not enough oxygen there. There is early sign that your body is needing some oxygen therapy. It's not enough oxygen in your lung to go to distribute to your whole body use. And then before that happen, usually before you get really ill, before you start to get shortness of breath, you would feel okay. But if you do a little bit more work, you try to work a bit further, you try to do extra work as compared to before, you now feel breathless. That means that you try to catch up your breath. So because earlier on, we also have received certain patients, they look okay. They look well, they can talk well, they can smile. They say that I'm not shortness of breath, but you ask them to walk a bit, or you ask them to stand up and down and do certain exercise, they actually start to feel breathless. And this is the early sign we can pick up to do something for them so that they don't get so ill. About this pulse oximeter, is actually now, this is a little gadget that I didn't get to show you here. We have it in our ward everywhere, that it will be helpful to actually check the patient, like, look at their blood oxygen. Basically to look at, through what we assess and see whether they have enough oxygen. It's one of the signs to detect happy hypoxia. And some of you may also come across that actually it has just been implemented in Singapore, whereby the government distribute one pulse oximeter to each household for them to actually, if they were to home quarantine, or even if they are not COVID infected, that you actually through that reading, which is abnormal, then you should seek healthcare. So this is one of the things that when we come to home quarantine, because apart from the home quarantine practice now in Penang, in particular, that not only that they will call the patient to get daily update, they need the patient who has some family member around who are either infected or already after infection to bring them to a nearby center for assessment. We call COVID Assessment Center, CAC. So some of you may have heard that, those are COVID, although you're home quarantine, you're allowed to travel, go to the nearest, this CAC, the center, to get yourself checked up every now and then. We have been having cases that we pick up, the doctor that pick up that this patient actually doesn't look quite good, but the patient could not recognize it, then they will send the patient to us. So back to the question, if you would get a pulse oximeter at home, you would have to learn to use it, and then hopefully it's not a faulty one, because there are many in the market, and then some of the gadgets are not as good as some others. So it is, you may have to go through some learning to pick a good one. So it will be beneficial in this sense, to help people either home quarantine or they are actually at home and suddenly they feel unwell. It may not be COVID. It could be that you may be having some heart problem or lung problem that you really need some help. So that is one of the indicator. Just like how we use the blood pressure machine, or you check your glucose.
Yeah, and we can see our audience said, from Singapore, so they can collect the oximeter start from 5th of July from Singapore. So hopefully Malaysia can do similar thing to those in home quarantine. Not sure, just saying. So what brand or model you would suggest? Oh, very political question.
I suppose, thanks for the questions. I think I in no position to do that, but just perhaps that is good for you to discuss with your local practitioners, to get their opinion. I think you can get some from some of the local pharmacy as well.
How accurate is the oximeter?
Again, depend on each of the gadgets, because if you look at it, the price varies. So sometimes, I'm not a technologist myself, and also not familiar in this,
But
informatics. Yeah, so I think like how accurate is that by the time that if you check it, generally I think they have some mechanism in there to ensure the reading is appropriate, because when you look at the pulse oximeter, it's not easy to use, because I mean, like for layperson, because if you are having your nail painted, or in a certain situation when you use it, actually it's not very accurate. That's why that as compared to blood pressure machine and also others, that this one, when we want to encourage people to use it, they need some training, or not really training, but some information so that they know.
not too difficult actually. And to answer those questions, actually there's a normal range for our oxygen level in our blood. So it doesn't mean like you are not 100% you are sick. So now I think the guidelines last time we said to be ideal like 98 to 100, and slowly they cut down to 96. And even in some cases, like some patients with underlying lung pathology, they allow up to 92. But still, it is good to get one and to compare to your baseline. Baseline means like your normal oxygen level. So it's not like if you're not 100% you are sick. So 99, 98 is still okay. And like what Dr. Peng said, make sure your fingers is not cold, and you don't have any like any other things to block the circulation to be checked. But I think this is a very good topic. Let us to explain again in Chinese. If you can. 所以刚才我们问何医生有关那个血氧仪，血氧仪是一个非常小的仪器，就是你夹在手指，然后可以测你的血中氧气的浓度。那一开始何医生有说，如果你染上那个新冠病毒，并不表示你一定会有肺感染，就它不是说一定直接性的可以引起肺感染。那在这个新冠病毒有一个很特别的现象，就是叫 happy hypoxia。那如直接翻译的话，就是快乐低氧或者快乐缺氧。那意思是说，一开始那个病人可能他的血氧浓度已经降低了。比如说他平常可能是100或者99，可能他现在是94、96，可是他还没有感觉，因为那个病变，那肺部的病变它是逐渐的在进行中，所以它不是一个突然间的让你觉得很呼吸困难，所以可能你没有这种症状，你没发现，所以病人还是很开心的在就是在活动，所以他们叫做 happy hypoxia。那刚才何医生说，其实是还蛮建议，对吧，何医生？就说如果你能够的话，尤其是那些在家中隔离的病人，可以考虑买一个就是品牌比较可以 reliable、比较能值得信任的血氧器，可以在家就是测一下。然后我们有些听众问什么牌子比较好呀？然后多准确那个仪器？我们的回答就是说，第一，当然你也就是当你测这个血浓度的时候，是有一些注意事项，比如说你的手指是不可以太冷的情况下，然后最好不要有那个指甲油啊什么的。然后不要说就是说你的浓度不是100%，就表示你肯定就是 COVID 了，可能还是有其他的状况，所以还是需要compare，就需要比较你的基础一个数量，然后这样子每天观察会比较准确。Can you do you want to 你要补充吗？
Yeah, I think the people were concerned about the level of the we call it the blood oxygen reading from pulse oximeter. So the general reading we would accept is safely to say is 95% and above. So if you are resting, you are 95% and you are not breathless, you are not shortness of breath, is considered still acceptable. However, when we come with happy hypoxia, what does it do is that when you check it, it actually is lower than 95%. It could be 92%, 94%, and then generally this is what we observe, 92 to 95, and sometimes go down to 90. Then they could still be actually happy and smiling. And the other category of people would be that actually when you check, they were about 95, 96%. They're okay. Or 98% is fine. But the moment when you try to do more work, let them walk up and down a little bit, squat up and down a little bit, they start to drop. They will drop to actually check the blood oxygen again. I mean, like the pulse oximeter, using the pulse oximeter, it will drop down to more than 3%. So it's like maybe go down to 94, 93, something. This is actually one of the alarming signs that we try to pick up whenever we deal with patient at the first assessment, because that is how we actually check that they could be at an early phase before they could get worse. That's when we can actually have some opportunity to do something for them, give them some treatment, so that to see if we can actually hold them, and even if they need some oxygen, it will be a lower requirement. I mean, like less oxygen they need, rather than end up to put in a wean pipe and then go into ICU and then stay longer in the ICU.
So we have a brilliant question, meaning in what level we are advisable to call ambulance?
Whichever, I think that it is 95, and 95 is still considered okay, but some people will take it up to 94. So whenever, if you have about 94, 95, what you can do is that we will ask people to just sit and stand. You just basically sit and stand. You can get a chair if you can't squat, but sometimes the young people, we ask them to squat. So for 1 minute, for example, you check now. When I'm talking, I'm sitting down, I check first. So let's say the reading now is 96%. So I will just sit and stand, or you squat down and stand up for 1 minute. After that, I check again. Usually for normal people, after you do exercise or something, your oxygen will go up a little bit. They should go up or maybe stay the same. You could end up to be 98, 97, that's fine. Some even will go to 9900. But if you do, after you do that exercise, and it end up to be from 96, it dropped to 93, this is the time you can actually call the ambulance, and they will entertain you. That's what we call, that is the warning sign. That means that something that's alarming that's happening. So you better get yourself checked out, regardless whether it's COVID or not COVID.
With the condition, the patient doesn't have shortness of breath. For example, the patient already in shortness of breath, regardless what oxygen level is it. So you have to seek for medical advice. And of course, like if the baseline is 100 and then suddenly drop to 95, I think it's something wrong as well, right?
Yes. Anything that after you do the exercise, as long as it's a drop of a 3%, that means that that's why that when we want to educate the public to do this, we have to be very cautious as well. Hence,
Yes.
the device, because we do not want to start creating a lot of worry, a lot of concerns and alarm in the general public. Then everyone start trying to test their pulse oximeter, even though they are COVID infected. Then they will go to the hospital and say that, I think I have that condition, I need to check for COVID. It should not be that way.
But again, I think it's a good to have an objective value. Like, if the patient's in home isolation, then at least they can check on their own and have a baseline and have some objective thing to look at and to discuss with doctors or, other healthcare persons. Yeah.
Yes, definitely. For those who are in home quarantine, they already got COVID, because what were the criteria that, because I think what we experience is that some of the people want to be home quarantine, but actually they are not suitable. Because in Penang practice, what we do, that we have many experienced consultant, infectious disease physician, that we have come to the conclusion that those with age more than 60 and above, with multiple underlying diseases, like you have diabetes, you have hypertension, you have heart problem, and even though you can home quarantine, by means of the other criteria, but because of this risk criteria, we would prefer them to be admitted to hospital for monitoring and then quarantine and then to give certain treatment if needed. So this is when they are in home quarantine for those people, then this device particularly will actually make a difference, at least for them to pick up earlier if they were feeling unwell, or even though if you want to do it daily, just for the 10 days of quarantine at home, it would be advisable as well. But we just again discuss with your health practitioner for this purpose.
Sure. Yeah. So what happened after quarantine? Like, how long is the quarantine, and what is the criteria to be clear from quarantine, and any follow up after that? And are they allowed to return to their workplace straight?
Yeah, thanks for the question. I think early on we have seen that there were some changes in the Malaysian guideline over the years. Early on, we do have a 14 days of quarantine compulsory, but with the latest evidence, we've seen that it's up to 10 days for now. The reason for quarantine, there are two purposes. Number one is to ensure that the person who got infected, they are no longer infectious. That means that they cannot pass the infection to other people. Hence, they need to be quarantined. And the second purpose when we have this put in place is actually to monitor the patient in case they get their disease progress. That means that they can get ill, because in COVID, you could get the infection earlier, but by day 5 to day 8 is a little bit critical, just like dengue, where you actually get a chance to get more ill and worse during this period of time, which we need to watch out for all these signs like hypoxia, or they get very bad fever, they get very bad diarrhea, and so on. So these 10 days generally apply not only for home quarantine, also for hospital cases. These are generally mild to moderate cases. For those who actually, if they are more severe, the symptoms are worse, and they need ICU care, and so on, we will actually keep them sometimes up to 20 days. So in a nutshell, 10 days is the standard quarantine period for now. However, if those who come back from a country, now I think we have heard a lot about variant of concern of this Delta, and earlier on, I mean, like, so as COVID virus is a living thing, right? So they are as smart as human beings, and they also evolve because they have the mechanism to make them survive, despite we try to chase them away. So they may actually be a little bit more infectious, and they require a longer period of quarantine. So for example, those who come back from India and a certain country where there's a high level of these cases, so their quarantine period will be 14 days. As compared to if you get it locally, we put it 10 days. Yeah.
I see. 10 days and 14 days.
Yeah.
Yeah, because in Australia, I think if the traveler come here, we quarantine for 2 weeks, and then plus another week if you are at high risk for variant. So it's like 3 weeks.
Yeah.
Okay.
Because we find it hard that sometimes that there is all the important public health measure based on what we know from a series of research to ensure that we can cut off the chain of transmission. So back to the question also, that what happened after this. The moment after you, in the Penang scenario, we tend to discharge the patient after they finish their quarantine period, unless in certain circumstances we will send them home to continue home quarantine if whichever situation that needed by the clinical teams. So once they are considered discharged from the COVID quarantine, they are actually, that means that you are no longer wearing your tag. We do have a wristband. We put a wristband for patients who are diagnosed with the condition for home quarantine or in the hospital. The moment when they are out of their quarantine period, we will cut it off, and then they are actually safe to actually travel and to go and resume their work, as well as to go to school. So we do have earlier on, I think people were a bit concerned that, you know, when were they considered safe to go out. So they should actually discuss with the doctor who discharged him, and then, you know, to get all those information. We understand challenges at workplaces because we do have call like, you know, why don't you repeat the second swab to show that it's negative, and then only then they return to work.
Yes.
So it was not easy, but this is one of a few changes. There were a lot of changes over the in the guideline over the period of time. For example, early on, we do actually quarantine them and then repeat the swab several times until they are 2 swab within 2 days, which is negative, then only we discharge them. That was earlier on, that what we understand about any infectious diseases, that which is respiratory in nature and highly transmissible. Then as more research coming up, it showed that actually there are a group of people, after you get infected, despite after you finish a quarantine period, that 10 days, 14 days, actually that virus can still have some remnant inside, stay in your nose somewhere, and they can be there for up to 3 months, but they are no longer viable, and then they don't infect other people. So sometimes you go and test, they will become positive, then you create another panic that, you know, the person is already quite well. So these are some little niche that we may want to look into. If, you know, so we took some effort to call the factory, and then we refer them to the guideline. The good thing is that we do have up-to-date national. So whenever they are unsure, we will ask them to refer to that. So if they're still not sure, then we will write a letter, a memo to test that, you know, the person is fit to go back to work in the factory.
I'm pretty sure those patients and even their families not only like physically affected but mentally affected as well, you know, based on all this pressure. Anyway, we have another session with another doctor to talk about mental health related issue coming up. So Dr. Peng, any myth or misconception that you want to clarify regarding, you know, this COVID? And
I think for the myth and misconception, there were quite a lot. It's hard to pick as we go on. I think we are all bombarded by a lot of information. I think this pandemic has taken us, you know, it accelerated health information and digitalizations, and then it also explored the use of social media. And sometimes you get certain information shared by someone who claims something here and there. And several, perhaps I would go by the treatment a bit. They were, one thing was, I think, as we go along, now in Malaysia, there was some few things coming up. Earlier on were these traditional Chinese medicine. And, you know, I think someone that I get to know close to my family, that, you know, for the herb medicines, in the past they could not import it because of some component in the herbal medicine that was not authorized by our National Pharmaceutical Regulatory Agency. After they reformulate it, then they allow to come in. Then people start stockpiling them out, and then they use it for preventive purpose. So we actually have the privilege to meet the group from China. I did the expert from China last year when they visited our National Institute of Health. So we actually have some conversations, and also we have some group discussion. And actually some of these herbs therapy, they are meant for people who are infected. And then, yes, there are some for preventive purpose, but if you want to use any of those, please get it from the right source, and then with the right counseling, you know, that right follow-up. Because we have patients actually, after they got infected and they took some of this medication, because these medications are very unique. They tailor-made to your disease stages and also progressions. So when your condition change, you actually need to change the formulation a little bit. It is not like one for all thing. So he took it, actually, he came in with a symptom because he got the side effect of that, which is diarrhea. And then it actually, all this herb, they could have other side effect if you didn't use it properly that can have impact on your kidney and also liver. That's number one. Number two, I think recently everyone was a bit more, excited is about this anti-parasitic drug, which we call ivermectin. It's one of the drug, I think in Australia, they are using it, if I'm not mistaken. It was one of the earliest report that the group actually start researching on it and find that this very cheap medication might work. And I think as we go along and trying to get more information about it, and the evidence is still, yes, some say it works, some might not, and then there are some. Recently, there are more informations about the misleading information that has been shared with the world. And currently in Malaysia, we are doing clinical trials on this ivermectin, where our hospital is also part of it, joining the team soon to look at the effect. So until then, always that, I think rather than rushing towards to get some treatment, because up to date, there is no cure for COVID as per se, that we are giving whatever we can to ensure that the person get well of it with a minimal complication. So some other myth was all about this wearing the mask. One of the things when they talk about this, the mask we are talking about, some you can see the two face of the two sides of the mask. One is with the color and one is a white one, and then different people will wear it differently because that they think that I want to prevent infection, so they actually wear the one with the color one inside, and then they expose the white absorbent surface outside. And again, this is one of the few things that people get some information. They think that, oh yeah, if I got it, if I'm the one who infected, I should not transmit to the other people. I should wear this way. If I want to prevent other people from infecting me, I need to wear another way. So these are the things that when we look about it, then it creates a lot more confusion. And recently, we also talked about this double mask. Why do we get the double mask? So maybe I would take this opportunity to share a little bit that the reason why you have two-sided, usually we want at least a 3-ply mask to be safe. 2-ply mask, a majority in the market is good, but this white color is actually the absorbent area where it should be always wear inside, not outside, because there are certain people, they say that they wear it outside so that they get themselves prevented from the infection from other people. But this
Can you bring
surface.
up your mask and show properly?
Oh, sorry. Yeah, this is the white color. Yeah. So they like to wear like this outside. So this absorbent, when you get, because earlier on we understand that COVID, they transmit by droplets. So imagine that you are wearing the absorbent side outside. When it falls onto it, it absorbs faster. And depending on how good the filtration property of the mask, that you might be putting yourself at risk and so on. So now when we talk about the double masking, why do we do that? Is because that if you are using the earlobe, because in hospital we are using those that we tie up, so we actually make it tighter. Wearing mask, the most important thing is to make sure that it is fit and tighten out as much as possible, so that we will close out all the perimeter around your face down to your chin, so that whatever droplet that actually come, they won't actually penetrate it, right? So when you wear this earlobe mask, if you realize it is a size fit all, and some of us have a bigger head, and some of us, especially our Muslim colleagues, when they wear the lady female, when they wear scarf, they could not strap it into the earlobe, and then they will use these little things like this to strap it at the back to tighten it up. So you may actually want to, some of us actually have learned that, you to tighten it up, you can actually make a knot and then to tighten it up. You can hardly see. So you make a knot like this to tighten it up. You can do that. Until recently, I think our Director General and also expert from the US, those infectious diseases experts, that they actually asked to wear another mask. Basically, the second mask is usually a cloth mask or of equivalent good fabric that actually the purpose is just to tighten it up so that you don't get a lot of space around you. But again, you please be careful. Whatever practice that we do, we try to say something, but there's always what if, there are always some other thing. Even though with normal mask, some of our elderly populations, our family member, you can see that it's very hard to breathe, especially those who actually have some phobia when they try to wear the mask, and then some with the condition that they have asthma. And earlier on, we even talk about, when you go for exercise, should you wear a mask? Things like that. So that is something that we should look into, and then always get the correct information. Whenever you're not sure, always get the right channel. And the other myth was like, there were a lot of other practices, for example, taking garlic, taking ginger, and gargle salt water and so on. And then as we go on and get the scientific evidence from trials, majority of them are actually not really strong. However, we also should not disregard our belief and culture in such a good sense that they actually serve other purpose. It does not serve to actually prevent you from getting infection, and it is not something that you have to do it very sensibly. However, it is something that it will help to boost up your immunity, because at the end of the day, for COVID, as we understand more now, it's a fight between your body and the virus. Your immunity does matter. So something that you do at one point can actually boost up your immunity, which some people say now you have heard of vitamin D, go and do some exercise, it helps. Things are evolving. So all in all, that whenever you get those, whenever you heard something which is two-sided, then this is where you may want to get clarification when the information are not that consistent.
Yeah. And I think, like you said, garlic, all these like sort of complementary medicine or even food therapy kind of thing, I think it is all right to take it in, moderate amount. But anyway, it shouldn't like substitute a proper treatment for your lung infection or this. So let's repeat it again in Chinese. 所以 do you want to say it?
I think I will let B. You are a better
Okay.
translator than me.
Yeah. 所以就是说，刚才何医生有谈到关于有一些食疗或者有一些草药方面的治疗，那他的建议就是说，比如说有些草药呢，有一些成分可能会导致一些肝或者是肾的损伤，那个你们就要稍微有点要注意一下。那比如说蒜头啊之类比较食疗、比较安全的食材，其实是可以的，适量的摄取是可以的。那当然，如果你已经是肺部感染了，这些食疗是不建议就是替代正规的治疗。然后何医生也说了一些就是疑惑，包括那个口罩怎么戴法。那2层或3层之类的，那可能你待会可以再看一下我们的video。然后by the way, I think more people are concerned about the brand of the oximeter. 所以好像很多人很关心，就是什么牌子的比较好。I think 就是对我来说呢，市场上其实有很多牌子的。只要他们是大的厂牌，我是说，最好是不要说淘宝买了的那种无名的牌子，只要是大的厂牌，其实都还可以的。你从正规的渠道去那些 pharmacy，那些药局买的， 大多数都是可以的。然后当然因为这个是一系列的检查，就是说你今天查了，明天再查，所以你会有一个 range， 一个范围，就是属于你的一个正常的范围。当然医学上好像刚才何医生说了，95或以下就是已经是一个 warning sign。那如果100、99、98，其实还是属于OK 的。对，Do you have anything to add on?
Yeah, I think basically it is. So I appreciate any question. So I think for the brand again, it's just like let's go back to talk about the blood pressure machine and also glucometer. At the end, so there's so many in the market. So we can just get a brand that you are comfortable with. You can read around it, or you can ask your health practitioner or friends of friends who are reliable. Because I think over here, if I try to suggest a brand, I think it's quite unfair to the others because there's many brands that I do not know about. Because over here in the hospital, we tend to use the one that the one that come with different gadgets. So it's not the one that we use at home. That the small little one that could easily cost 20, 30 ringgit up to 150 ringgit for one device.
Yeah, and I think I only know few brands, for example, the Media Sana, B Brown, Siemens, all these kind of big brands. Yeah.
And
So,
maybe I will just share some message. I think as we go along, we have long talk about post-COVID. We have learned from COVID, try to prevent ourselves from getting COVID, and then the new norm keep emerging and changing, and then now we are in the so-called post-COVID but not post-COVID era. You can see that despite vaccination and so on, the cases here come down and then go up, come down and then go up. Japan, the UK, and then now even China coming up with the Delta strain that how they actually penetrate China. So there's a lot of uncertainty, but certain thing that we have learned over the time is basic things remain basic. Take care of yourself, wash your hand, and then whenever you go out, avoid crowd area, wear your mask properly. And one of the things that I always encourage our colleagues also, especially if you're working in the hospital, is to get your goggle or a face shield. Your spec is not good enough because now we have learned more about the virus. COVID is aerosol. That means that they can run in the in even smaller, as a smaller particle run, circulate in the air. So this is a goggle, for example. This is a goggle. If you look at the design, whenever we wear it, if you are not wearing spec, it fit very well. If you can see it, I'm not sure if it is a good, it actually covers the things. When you wear the mask and you cover it, you actually cover, because we have cases reported that, they actually COVID infected the person through the eye, where therefore, if you wear the goggle, actually it prevents it, the droplets to go in, and then you cover it properly. Alternatively is, the face shield that we wear. So there are also many, especially when you go out. But again, only if you are comfortable. If you are wearing specs, actually this is quite, some of these are quite flexible one. You can actually lock, there is actually a lock at the back of the earlobe. If you are wearing specs, yeah, unfortunately, I cannot really fit it very tightly, but they will still provide some coverage to make yourself comfortable. So these are the things that, we can protect ourselves. And every time, if we go out and do something, before we touch our mask and goggle, always wash your hand. Any disinfectant is good. And when talking about the myth, I think we are still, some of us are still using, the disinfectant spray. You like to go into one chamber and then you spray yourself, get yourself clean. And that actually has very little evidence, and it do no good, because we have seen a lot more people get a skin allergy, and then some of the substance they use are actually quite harmful to the body, especially when you inhale them. So yeah, this is the thing. And then so please take care of yourself, do some good exercise, keep yourself healthy. I think in the time of a very difficult, challenging time, I think some of us lost our job. When we see our family or friends or even colleagues who suffer, always try to help. You know, if we cannot help, we can direct help to them or get them help. So I think, can I take this opportunity just in case to just share something either by the Penang state government or the NGO that actually there are some food bank program. So if you have anyone that you think that need help, you can actually contact us. Then we can direct them to the person. Then they will post the food to homes and so on. So to help them, I think the one last thing we can do is to make sure that people get food to eat. Keep them sane. Then
Yeah.
I think that the mental health section is extremely important,
Yes.
especially when we see so many repercussions now. Actually, Malaysians are quite resilient. We have to say that we are quite resilient in the sense that,
Yeah.
in fact, now only start to search, especially when, the buffer period has gone through, I have finished up already. So thanks for listening to my talk. I hope I answer some questions. And then again, it's all about personal experience, and hopefully you can clarify with the health practitioner in your area. Well, shall you need further information, don't hesitate to contact me and then or myself. Then we can have a chat.
Yeah. So thank you so much, Dr. Peng. I know you are very, very busy. So as you said, mental health is another big issue. So we have another topics to talk about the mental health issues. We have one PhD doctor to talk about it, and we have a counselor certified psychotherapist to talk about cognitive behavioral therapy. And then we have another doctor to talk about the vaccination. And I strongly believe Malaysian can make it. And we really thank to our all frontliner like you, Peng. And it's such a good effort that government put into the food bank, all this thing. But my last question, you mentioned about the goggle mask or even the clip. Are they easily available in the market? Because I remember when I was in Malaysia, it's so hard to find a mask. How about
It's
now?
everywhere now.
Oh, it's everywhere now.
I think earlier on there was some price fight, and then the stock was not enough. Now I think you can get masks easily everywhere. So again, that we have to, one last thing is that when we have to keep our mind dynamic as well, because we have to be prepared for uncertainties and also be prepared for the change, because we do not know what will come. In fact, I think Singapore has also, I like to quote our neighboring, because that's as much information that I get, that I think slowly we are moving towards perhaps, the Singapore after they achieve their vaccination. What next? What is next? We can't be keep up as a pandemic for such a long period of time that, they would treat it like flu, because people who get vaccinated, they may get milder disease and so on. So, you can see policy are changing. So whenever we have confusion, we always stick to the formal one. We always not all the side news, all the certain online news that come here and there, and then start to confuse your interpretation and also challenge your wisdom. So, yeah. I think Malaysia, we can do it very well. And thanks to me. And I think this is one of the effort greatly suggested. And in fact, we talked about this webinar things about less than 2 weeks ago, and B is always very excited and very innovative and always open up. In fact, he get this done in a very short period of time. Hopefully will benefit all of us. So it's really great to see everyone, and thank you for your question, because you also taught me to think about the brand. I have never thought of giving pulse or oximeter to others apart from reading it.
We hope that government, at least state government, can sponsor some for those, with low income, probably.
I believe as time comes, things, as we look at it, because now we are seeing more and more ill patient, and we suspect that if something has changed that we yet to pick up, and hopefully will pick up soon, that we are seeing more young people who get ill very quickly, and then they got into ICU, and some of them didn't make it. So
prevention comes first. Prevention, and then early detection, and of course early management. So as Dr. Peng mentioned, so protect yourself and build up your immune system. Stay happy, stay positive, stay healthy, stay safe. Yeah. So thanks again. Thank you, everyone. And we will update about our next live session on our Facebook page. So share with your friends. And our next session will be on 11th of July, next Sunday. We will have 2 sessions. One is about parent and child interaction. Another one would be urban farming and microgreen. 所以我们下个星期日再见。我们会有2个讲座，一个是关于亲子关系，然后还有一个就是微型蔬菜种植。然后再次感谢何医生或 Dr. Peng， 我知道他非常的忙碌。那也谢谢大家就是支持，然后提问题，然后请你们分享出去，然后就是我们还有一系列的live session， 希望大家保持正能量，然后呢保护好自己，然后我们相信马来西亚能做到的。We hope
we all can make it.
Yeah, thank you. See you guys.
See you. Bye.
Thanks again.